The common types of acne that we're used to seeing: hormonal acne, acne cosmetica, inflammatory acne, asphyxiated acne, systemic, back, and rosacea acne. We'll get into each one of these. Hormonal acne statistics: about 85% of teenagers suffer from acne. Nodular cystic acne is more common in white males than in black males of the same age. This is typically between the ages of 15 and 21. 44% of women suffer from cyclical breakouts. 20% of all adults suffer from acne. Acne tends to persist. Flare-ups in 8% of men and 6% of women happen well into their 30s, which shows the importance of continued treatment. As soon as I get an acne client, one of the first things I say is you need to get your acne under control, and you need to make sure that even once the acne subsides, you continue with your treatments. It's important that we keep it under control, and it can absolutely persist. It's a very, very persistent skin condition, especially for women, how our hormones fluctuate throughout our lives. It explains why acne in women is typically something that we see more than in men. And we also know that hormonal acne typically affects the lower half of the face. We're usually seeing the breakouts in the chin or the jawline, but it can certainly affect everybody differently and certainly affect your whole face or different parts of your body as well. Hormonal acne is very common in adolescence. The sebaceous glands and the apocrine glands begin to function only during puberty. So although we always have these glands, we're born with them, they mature at this point in our life, which is why we start to see the breakouts happening during puberty. Acne is typically accompanied by an overproduction of sebum and may be present at any age when the hormones fluctuate. So hormonal acne, what happens? The androgen hormones directly affect the follicles. Androgen hormones are in men and women. They are more dominant in men, but women also experience those androgen hormones as estrogen and progesterone levels fluctuate throughout our life. The testosterone is converted to DHT. The base of each follicle contains androgen receptors that are highly receptible to this DHT, and when they're stimulated, they increase the size of the sebaceous glands and the amount of oil secreted. Again, typically we're seeing the effects on the lower half of the face. Hormonal acne can also affect newborns. We call it neonatal acne, and this usually occurs in newborns, usually around 3 weeks of life or so. And this is really just a result of the maternal hormones still circulating in the baby's bodies after birth. Once those maternal hormones are released from the baby's body, you'll see the acne clear up. So this is something that we should not be landsetting. Typically, it looks like little tiny milia. And as estheticians, we really have to resist the urge to extract our newborn baby's skin or to put a lancet to their skin. Don't do anything. It certainly subsides on its own. Once it's balanced, the androgen and estrogen levels remain very low and are nearly equal in males and females until puberty, when we start to see those big fluctuations. At puberty, this is when changes in the skin become very apparent, okay? Hormones are responsible for the maturing of the oil glands. This is why children don't experience acne. This is why at pubescent stages in life is when we typically see it happen. And usually girls, it's affecting them between the ages of 10 to 14, boys between the ages of 10 to 17. Again, it can persist into adulthood, and it's because of testosterone, typically more severe in males, normally clears by the mid-20s. Females have a higher risk of acne recurring into adulthood because of the fluctuation that we experience. As far as women go in the menstrual cycle, we know we usually get those breakouts at that time of the month, right? The menstrual cycle is a 28-day cycle. It is a constant fluctuation of various hormone levels within our body. These varying hormone levels can certainly make our skin look better or make our skin look worse. Day 1 is the first day of our menstruation. Days 1 through 7 is when estrogen increases, really helping to keep our skin looking clear. Days 7 through 14, the skin looks good. Days 15 through 28, estrogen levels decline. The blemish potential increases here. Peak days prior to menstruation, progesterone levels increase, follicles swell. This causes the pores to compress. The pores are smallest about a week before menstruation starts, and there's an increase in sebum, plus those constricted pores. This makes it an ideal place for acne to develop. Some people will go on birth control pills to help regulate these hormone levels. Some of them have actually been FDA approved to help treat acne. So if acne is a concern for you, you can go on birth control to help treat it. Again, the polycystic ovarian syndrome is something that we need to be aware of as well. Typically, I tell my female clients, if this is something where you're seeing flare-ups and breakouts before you get your period, get a facial about a week before your period comes, and this will help to eliminate the bacteria and the dead skin cells on your skin. A lot of times we see an increase in breakouts during pregnancy, typically in the first trimester where we're seeing a surge in those hormones. Usually you'll see those breakouts start to slow down between the second and third trimesters, but it may return again about 3 months after you deliver when your hormone levels return to their pre-pregnancy levels. So many wonderful things for women to look forward to, right? Some pregnancy precautions that you do need to be aware of. Obviously, any medication that we take topically or that we apply topically or that we swallow will enter the bloodstream. So it is very, very important to always ask your doctor if they're safe to use while you're pregnant. Things like retinoids can be toxic to the fetus. They may lead to birth defects. Avoid frequent use of benzoyl peroxide, salicylic acid, isotretinoin, which is the generic Accutane, minocycline, doxycycline, tetracycline. These can all cause complications. If you're even planning on becoming pregnant, don't use anything with isotretinoin in it. It can absolutely cause birth defects. In fact, when you start using Accutane or the generic forms, you actually have to sign a waiver saying that you're going to use multiple forms of birth control because it's such a high complication for pregnancy. So I always let my female clients know. I know a lot of women don't like to reveal that they're pregnant in the first trimester, but I always let them know if I know they're dating somebody or if I know they're getting married or thinking about getting pregnant or whatever. Please let me know. There are certain ingredients that I cannot use on you while you're pregnant, and I promise them from the depths of my soul that I will not reveal to anybody that they're pregnant. That's certainly something that is up to them when they want to reveal that information to people. So confidentiality is a must, but it really is important that your clients let you know if they are pregnant in that first trimester. When we start talking about hormonal acne, when it's in terms of perimenopause and perimenopause and menopause, it's important to understand what's happening in the body at this point as well. Perimenopause is the period leading up to menopause. It typically lasts an average of 5 to 8 years. Menopause, we know, is the permanent end of menstruation and fertility, usually occurs between 45 and 55 years old. The ovaries' production of estrogen and progesterone levels slow down. So it might seem strange that as our hormone levels are dropping that we start to develop more acne, but actually it's very common at this stage to see this because as those female hormones drop, testosterone becomes more dominant, which causes an increase in sebum production. So it does affect women very, very differently. Not every woman is the same in their physical and emotional reactions to menopause. And typically, if you are seeing breakouts at this point, it is temporary. It usually does subside once menopause is over. But it is something to be aware of and explain to your clients what's happening in their body and why they're seeing breakouts at this point. Perimenopause and menopause can cause surface dehydration to decrease with age because there's less surface lipids and ceramides. When this happens, it traps the oil beneath the surface, which adds an increased risk for breakouts. We do need to clear up the misconception about dry skin as we get older. The dryness with age is not from a decrease in oil production in men and women until the ages of 70 to 80 when the androgen levels drop. The dryness as we age is water dry, not oil dry. So it's important that we understand this. The reality is that sebaceous glands actually enlarge with age due to the decrease in cell turnover. So it's really important that we keep using hydrating products at this point. If the skin is dry, extractions become very, very difficult. And some experts do believe that hormonal replacement therapy will help to balance the hormones and cause a less chance of a breakout, so that's an option for people as well. But this is a great opportunity for us to be doing facials on our clients to help clear their skin up much faster and to add that hydration in that they need. Acne Cosmetica is triggered by comedogenic or irritating ingredients, and this can be from the makeup that we use. It can be from laundry detergent, hair care products. A lot of time products contain fatty ingredients or waxes or oils that can certainly aggravate the acne that we have. A lot of times products are just too occlusive or too heavy, and it can cause the cells to stick and cause blockages to happen. It's important that if this is something that we're worried about, that we use products that say oil-free, that say non-comedogenic, that we're using things that certainly won't clog our pores. Typically, this affects the cheeks and the chin area. It can appear as small whitish bumps or grains. It's more noticeable when the skin is stretched. So when you're doing your skin analysis, just stretch the skin a little bit, and you'll be able to see this very, very clearly underneath the light. You can also feel it just as you run your fingers over the skin. It does tend to scar less frequently because it is more superficial, but it is important that we're doing things like changing your pillowcases regularly, cleaning your makeup brushes every week at least. This is something that can be hard to clear up because typically when we start to see these breakouts, we tend to cover them up with makeup, which causes more breakouts, and it becomes this vicious cycle. So if we're seeing this happen, try to use no makeup until the acne clears up, or use it very, very sparingly. And then once it clears up, just add in one component of your makeup at a time so that you can understand where or what product it is that's causing these breakouts to happen. Inflammatory acne is also referred to as comedonal acne or post-adolescent acne, which is also known as CPAA. It's very red and inflamed and uncomfortable. This is something that we really need to be diligent with our skincare regimen, both morning and night. We need to be careful with our food regimens. We need to make sure that we're not skipping meals. Smoking can play a part in this. You know, generally smokers tend to have more of a dehydrated, porous, dull complexion. They have more visible capillaries. All of this causes congestion underneath the skin. So again, we need to remember that the skin is the largest organ of elimination. The skin is going to reveal what's happening inside of the body. If the skin is congested or sluggish or dehydrated, something internal is probably going through the same thing. Smoking clouds the air that we breathe, and it clouds the inside of our bodies as well. So keep that in mind. Talk to your clients about this as well. Dermatologists examined 200 women between the ages of 25 to 50 years old to assess the acne type. 85% of them had CPAA. Something to think about also, once we get into our 30s, our stomach enzymes are not as active as they were in our late teens or early 20s. So this is when it's really important to make sure that we're eating smaller meals more frequently because digestion puts a lot of stress on the body. The bigger the meal is, the more we are improperly combining our foods, the more stress the body is under to really properly digest that food. So we need to make sure that we're eating smaller, more frequent meals and that we're properly combining our food. Asphyxiated acne is basically when the acne appears dry, the skin appears dry on the surface, but it's oily underneath. It feels rough. There's a keratolytic buildup and reduced cell turnover. The sebum and other debris gets trapped underneath the skin surface, and this becomes very common in drier environments where the skin tends to dry out on the surface. It can also be caused by drying agents like alcohol, or if people that have acne are not using a daily moisturizer. And this is why we keep on stressing. If you have acne, you still need to maintain the hydration level, the water level in your skin. You need to use products that are non-comedogenic but are also going to be adding that water content back into the skin. Otherwise, you're dealing with a whole other beast here because those impactions in the pores are getting dry and they become very, very hard to extract. Systemic acne is also usually known as acne vulgaris. It typically affects the arms, the chest, the back, and the shoulders. Remember, this is where there's very dense amounts of those oil follicles happening, but this is also areas where there can be a lot of irritation, whether it's pressure or friction from our clothing, from our hats or our hair products, or maybe backpacks, anything like that where it's causing friction on the body. It may also be brought on by disease, illness, medications, irritations, diet-related issues. A lot of times we'll see these breakouts happening when there's warm weather, because when there's a combination of perspiration and heat and friction caused by either tight clothing or you're not allowing your skin to breathe, the sweat acts like a film and it traps the oil and the dirt and the debris in the pore. So if you sweat a lot, it is important that you shower frequently. You don't want to treat it by drying it up, but you do want to make sure that you're cleansing and exfoliating those areas. You also want to make sure that you're wearing loose-fitting clothing so that your skin can breathe. You also want to make sure that if you're using detergents in your clothing that contains heavy dyes or fragrances, this can irritate the skin as well. So make sure that the soaps you're using, the detergents, the fabric softeners can sometimes leave like a waxy film on your skin. Pay attention to all of this. Back acne. It typically develops and looks very similar to facial acne, but because the glands on the back are larger, they can produce more severe lesions, nodules, and cysts. And because the skin on the back is thicker, the treatment can be more challenging. On the back, there's tough skin. There's thousands of sebaceous glands. They're larger than the ones on the face. They can produce more oil than those on the face as well. About 2/3 of people with facial acne have some degree of back acne as well. 20% of healthy adult males have some amount of back acne. Back acne is more prevalent in males. Back acne is more common than on any other of the extremities. There's also Acne Mechaka, which is caused by irritation of the skin. And this is where we're seeing a combination of friction and sweat. And it's really anything that repeatedly rubs against the skin, whether it's the backpacks, again, the tight clothing, weightlifting machines, anything like that. Certainly can be aggravated by moisture, so if you can't shower after a workout, at least make sure that you're changing your clothing. Again, be careful with the fabric softeners, things of that nature. Make sure that you're wearing breathable clothing. Maybe carry your belongings in something other than a backpack so that you're not getting that friction on the backpack. Again, make sure that you shower after your workouts. Rosacea acne affects 16 million Americans. 78% do not even know what it is or how to treat it. So again, it's important that we know what we're doing and we know our knowledge so that we can educate our clients. It can look very similar to acne vulgaris, and they can often be confused. So this is why it's so important that we make the proper diagnosis in this case, because the treatment for acne and the treatment for rosacea are completely different. Typically, rosacea acne is confined to the cheeks, nose, forehead, chin. It's often accompanied by bumps, pimples, blemishes. There's no blackheads when we're dealing with rosacea acne. It is more prevalent in women, but if men have it, it is way more severe. So let's look at a chart that's going to show you the differences, and this is a good comparison chart so that you can really learn the differences. Rosacea is a progressive vascular disorder. Acne is an overactive sebaceous gland disorder. Rosacea typically affects the ages between 30 and 50. Acne is typically between 14 and 19. In rosacea, papules and pustules are from impurities built up due to the lack of blood circulation. And typically, if you extract these, you will not get a white pus like you would with acne. Typically, what you'll see is a clear liquid coming out. In acne, the papules and pustules are caused by those P. acnes bacteria that we talked about. Papules and pustules are limited in rosacea to the cheeks, the nose, and the chin, where in acne, a lot of times you're seeing them in the T-zone. Rosacea, there are no comedones. In acne, absolutely you can see comedones. Rosacea, you're also starting to see swelling, telangiectasia, and visible capillaries, and in acne, you're not seeing any of that. So there are very clear differences between the two conditions. Again, very important that we diagnose it properly so that we can make sure that we're treating it properly, because the treatments are so different